So I don't feel like we can have a full course on trauma without starting with trauma assessment. A lot of, if you think about things that happen in the medical field, medical side of things, it's like, oh, somebody has abdominal pain and we figure out it's a ruptured gallbladder. Well, can we do in the field? Well, nothing. We're not going to do anything different if it's a ruptured gallbladder or ruptured ovarian cyst or just a stomach ache. There's really nothing different we're going to do. It's pretty rare on the medical side of things that we can diagnose, and then if we can diagnose, it's pretty rare that we're able to give a treatment that's going to make a big difference in the patient's outcome. However, on the trauma side of things, our job is basically plug holes to keep the blood in and keep the air circulating in and out of the body. And we can really get in there and do things to save the patient's life, or at least to keep them more comfortable by putting on splints and things like that. But it all starts with being able to find out what's wrong with them. So without a good trauma assessment, it doesn't matter what you know or what tools you have or what you're capable of. If you don't find the injuries, you can't do anything about them. So we're going to start off here with the trauma assessment. Now, before you close your computer and walk away, don't worry. We're not going to spend, I'm not going to go too crazy on the trauma assessment skills sheet. So most of you probably remember this from your initial EMT class. It is basically a list of steps that you have to perform to get a perfect score to do a full trauma assessment. That being said, it's a good place to start because it'll kind of help guide our discussion here about everything that's important. So the scene size up, this is all the stuff that happens before you get on scene. Equally as important, if you get injured because you're not making sure the scene is safe and wearing your PPE, you can't help anybody else. Calling for that additional help early, especially if you have multiple patients. And of course, in trauma, we're thinking about the C-spine right away. Now, that might not mean we're putting on a C-collar right away, but we're at least thinking about the cervical spine and how we move that person. If we think they have a possible spinal injury, it's going to kind of dictate our care throughout the assessment. So we jump right into airway, breathing, circulation. Now, for years and years and years, this has been ABCs, ABCs. I still call them ABCs. A lot of people will call it CAB. They're not wrong. I'm just giving you a little bit more credit of intelligence here. So the reason that people have changed that is because we used to, no matter what, we used to always treat the airway first. And then once the airway was open, we would move down and treat bleeding. And this changed over time. We now know that if somebody has life-threatening bleeding, it's a waste of our time to worry about opening their airway and suctioning their airway and getting oxygen applied and all that if they're bleeding to death. Someone's going to bleed to death within just a few minutes, possibly, depending on how severe the bleed is. So if we see severe life-threatening bleeding, we're going to talk about how to treat that later. But just for now, for the order of things, that severe life-threatening bleeding should be treated before the airway. Now, I'm still going to say ABCs because it's easy to say, but you should think of the ABCs as a chunk of things that need to be done before you move on. And that is your ABCs are treating all the life-threatening injuries that you see right away. So life-threatening bleeding, anything with the airway, all of that kind of stuff needs to be done. Keeping in mind that life-threatening bleeding should be treated first. If you want to call them the CABs, or I know there's terms from the military, MARCH stands, the M starts with massive hemorrhage, then airway. All that stuff, that's fine. Whatever helps you remember it. Me personally, I'm probably not going to be singing the alphabet or spelling words when I show up on scene and somebody's squirting blood everywhere. I'm going to take my gloved hand and cover the bleeding. That's what you need to remember, and that's what you need to do. So we're going to talk a lot about bleeding later, so I'll move on. But we're going to treat those life-threatening injuries first. Bleeding control, airway kind of stuff. That's honestly the most important part of your trauma assessment is right there in your ABCs. That's where you're going to do life-saving care. We move beyond that and we look at the rest of the assessment, we might find something else life-threatening. So that's why we do that head-to-toe assessment. So when you're in your ABCs, you're looking for blood and you're looking for obvious stuff. But then when you get down past your ABCs, that's when we're going to go back and double check. Okay, I got all the obvious bleeding, but I'm going to check every square inch of the body for any other bleeding. So as you're doing your assessment, and here on video, it's not really going to help much. So I'm not going to go into every detail, but you're checking everything on the body from head to toe, and then rolling the person over and checking the other side. If they're supine when you started, that means you're going to check the front of them and then roll them over and check their back. If they're prone when you started, kind of depends, right? If you come up to somebody who's prone, they're laying face down and they're having, you come up to them and you say, "Hey, are you okay?" And they don't have any response. That concerns me that maybe we have a life-threatening airway problem. I'm going to also look for life-threatening bleeding. If I see that, I'm going to treat it before I even touch them. I'm going to go straight to that bleeding control. But if I talk to them and they don't respond to me and I've already treated the bleeding I see, I'm going to immediately roll them over. I'm not going to palpate their whole back and put a C-collar on and all this stuff. I need to check that airway. I'm still up in my ABCs. So I'm going to roll them over and check their airway. Now, if I come up to somebody who's face down and I say, "Hey, are you okay?" And they say, "Yeah, I can't feel my legs. My back really hurts. I don't know. I'm fine." They're talking to me. Their airway's open. I've basically checked the ABCs. I'm going to look around for any blood. ABCs are done if they're talking to me and I don't see any bleeding. Now, in that case, I'm going to check their entire posterior, their whole back, the back of their legs, the back of their arms, put a cervical collar on them, then roll them over. Now check the front of them. So the order is going to kind of depend on, where those life-threatening injuries are. So again, most of our effort here is going to be focused in those ABCs. Airway, is their airway open and are they breathing? And circulation, are they bleeding? And again, if you see that life-threatening bleeding, you're going to treat that first. And then that head-to-toe assessment, start at the head, work your way down. It's not really important what order you go. What's most important is that you do it the same way every time. I personally like to come down the torso to the pelvis, continue onto the legs, and then come back up to the arms. Other people say, "Oh no, if I go past the arms, I'll just forget them." So they come down to the neck, they check the shoulders and the arms, then they check the torso, and then they continue down to the legs. Uh, Things that I commonly see people forget to check: the pelvis and the ribs. Two very important places. If you have broken ribs, you may have more issues managing the airway. If you have a broken pelvis, there's a really high chance of a significant amount of internal bleeding. So making sure that pelvis gets checked. And when you're checking a pelvis, you're feeling for anything that would be any kind of instability in the pelvis, or if the patient tells you, "I have pain in my pelvis," I'm probably going to put a pelvic binder on to hold that pelvis together. So I could go on and on and on, but basically we're going to talk about how to treat all these injuries we might find throughout this whole training. So for now, I'm going to leave it at that your assessment should focus on those life-threatening injuries. And then if time, check out the entire body, get your hands in there, checking for gloves. I'll tell you one of my pet peeves. I know they look really cool, but I have a strong dislike for black nitrile gloves. If you have black gloves on and you do you're doing your assessment and you look at your hands, you might be able to see that they're wet, but you won't be able to tell if it's blood or not. So I really don't like those black gloves. I know they do look nice, but just keep that in mind. Okay, I'll see you in the next video. Thanks.